we are trying to reduce stigma and discriminatory practices against the marginalized groups in order to enhance uptake of health services amongst the groups and also to encourage recognition of human rights. Who are these marginalized groups? Say people with disability, people living with HIV and AIDS, and the most at-risk population. Then we moved further to orphans and vulnerable children as the other audience, and lesbians, gays, bisexual, transgender, and intersex. Now, these marginalized groups are largely excluded or discriminated against by the virtue of their orientation, that is physical, health, and social status. For example, most of the healthcare providers are not trained to deal with people with disability, e.g., deaf patients get it difficult to interact with health officers or clinicians who are providing services because of the sign language. Then people living with HIV are still secluded or discriminated against in the community, and some are not even given opportunity in the process of decision making in their communities. We also talked about creating a platform for the marginalized groups to share their experiences, challenges, and stories, effectively giving these users a space to voice out their opinions and grievances so as to highlight their plight in the quest for access to health. So what we proposed in terms of technology is that we were referring to the Kenya situation, that we can come up with a platform such as the USAID platform, which will enable a two-way conversation so as we can send in the opinions, sentiments, and share experiences using SMS, email, Twitter, and even Facebook. Now, in terms of existing solution, we tried to ransack ourselves, but we realized at the moment, not much. There's no any other person trying to get a solution. Then we came up with a follow-up plan. Create crowdsourcing platform. We're proposing that USAID can be a leader agency. Then we are talking about structuring the data through NGOs, CBOs, civil society organizations, and even the government, and also develop a resource envelope so that we can really move on with the plan and also involve partners and stakeholders through the social network.
Our summary problem